hospital systems in particular are using big data to determine whether they're going to invest in a property or perhaps de-invest in a property. Right now, with all of the outpatient factors expanding into communities and outside of the hospital, they're looking to see what happens to the hospital after it has all these outpatient services come out of it. So do you do the retrofit, seismic retrofit of California, and you want to keep the tower? Do you want to put more beds in? Do you want to renovate the facility? Most likely not. In these cases, a lot of the times they're either half vacant or perhaps the department has moved. So some of these towers are being decommissioned or turned into other types of things. You have, skilled nursing, or you've got perhaps apartments or offices, different kinds of uses. And the other trend that we talk about is, telemedicine. And even though it hasn't really fully taken off yet, you kind of have this trend of either one of three things: either the FaceTime type of telemedicine, where you're basically talking to your physician on a tablet or other device, and they're giving you kind of just your typical consultation. The second type being more of an assisted consultation, where you're actually sitting with your doctor, but perhaps a specialist is on the tablet or other device providing assistance. And the third type is in complex procedures, where you have maybe a surgical specialist or some other kind of doctor that's far away, that's not in that city, but you need their unique expertise. It's really unknown right now how it's going to affect real estate. We are building telehealth services into some of our facilities that we're designing within the traditional model. So some of the exam rooms are exam/telehealth. So they're kind of predicting for it, but I don't think it's very clear exactly how it's going to go. It's not going to be like everybody's going to have their doctor on the tablet and the hospital goes away. It won't be that way, but it will definitely reduce the amount of trips that you take for routine procedures, routine checkups and things like that. So we're seeing a lot of, for the past few years, a lot more services moving out of the hospital into outpatient care. So there's medical office buildings, outpatient clinics, and some of the services that don't need to physically be in a hospital because they're not as acute move out outside of the hospital and create some of these more kind of outpatient campuses, and even moving into retail, moving into home care sometimes. So definitely not as many new hospitals being built, smaller community-centered facilities. Sometimes that's a micro hospital, sometimes it's an urgent care or an ED. The healthcare facilities are, and healthcare providers are really focusing on the patient experience. They're all competing with each other. That's one part of it. The other part of it is really, it's been scientifically proven that the outcomes are greatly influenced by the environment. So if you're in a dingy, terrible hospital, you're not going to recover as well as you are in something that has a lot of natural daylight. It's the ventilation requirements are met. All of these things that are in a new healthcare facility, that really is pushing the trend towards not only more patient-centered design, but also more of the patient experience. So it's not necessarily about you're getting your healthcare. It's when you come in, what do you feel? Where you're going through point A to point B, is everything clear? Is it stressing you out? Did you get lost on the way? Do you have clear signage to make sure that you are progressing along what we call the patient experience, and it's all continuous? And that, design plays a part in that, as well as what kind of a facility it is and what it's providing.